Hi everyone. Today I have a guest with me, Jonathan, who is at Episource. So maybe Jonathan, you can introduce yourself a little bit about yourself and what you're doing at Episource.
Hey everyone, Jonathan here, and I'm just delighted to get invited by James and the Opsin team to talk about topics today. I've been in the industry for, say, 20 years, working as a technology leader, running fintech, healthcare tech, plus many other organizations. Very familiar with many areas of technology challenges, opportunities, and I think it will be an interesting discussion today about what Opsin is cooking.
So the very first question that I have for you is there's a lot of debate and discussion around AI and how much value it brings to different industries. From your experiences working at Episource, could you explain a little bit more about what's the adoption that you're seeing in the healthcare industries? Like, what's the current state of AI adoption in healthcare industries?
Absolutely. I'll share about something about background about the healthcare system, what we are based upon and the principle. The core principle of healthcare system is value-based care. VBC, this is what people talk about. Value-based care means about using what we have, the data, what we have system, what is the process we have to drive better patient outcome. The insurance carrier don't get paid because of how many visits that you went in. It's about the outcome you have. Do you ever take care of your what you're going into for visiting a doctor? Maybe today you're going in for a cold, and you're looking for cold medication. Great, and this is a good outcome. You feel a little better at the end of the day. Or maybe someday you're just going for because I have a very, very bad headache, dealing with all day long meetings, and you didn't sit well because you catch a cold, and you may ending up with getting a lot more or considered diagnosis because it happened during your visit, and you ending up with a 6 different type of blood tests. Hey, because the doctors find that hey, you may have a little bit other issues along the way. So the value-based care is about at the end of the day, how well do you feel? Does the healthcare system have enough resources to support your health being? That's health system that we're living in US. In particular, AI, I look at the adoption rate is very, very low, but this is just a reality in many cases. But if I think deeply, AI has been in the system for very, very long. Especially AI, if you how I define AI, is data science. Data science, you collect a whole bunch of data, you try to figure it out a pattern. You try to figure it out in many cases of what does it mean on this set of data? How come there's so much population in this area doing this type versus the other population? It's already statistical analysis that time trying to use AI to build what business wants. And I think this has been here for a long time. But if you looking at the new generation of AI, people call it GenAI. I think we still have a little bit use case that we have to define. But I think it's quite adopted in the industry. We just don't even know.
Yeah, I think that's really good to know about how healthcare industry is a value-based care in which you care deeply about the patient, making sure that the outcome they have is a good outcome. So with that being said, like how are healthcare organization integrating AI into their workflow, and what kind of challenges that you face in terms of data security?
Healthcare, we are scared. We are very scared about what kind of data we have to process. We are not processing credit card data. Just hey, you can reissue a credit card number and be done. We are not just talking about social security number, which in many cases security number is no longer safe. We talk about human health records, your medical history. That is a much significant value to the threat actor. First part is cybersecurity, and the second part of that, the characteristic of the data is huge value in their many cases because you would drive, again, better outcome of patients. So maybe have better medications, that outcome of clinical research. But we are very scared of what we can do with the data because there's always the factor is big P called privacy. Privacy is always a big thing that we're really scared. It's a huge market opportunity, but how can we use it in a more responsible way? And also, how can we make it more transparent to the people that we serve? Is always a big question that slow the adoption down to very much like we're crawling right now. We can only crawl before we can walk. No, we are stopped right now to figure it out what it needs. Again, the outcome is the VPC, value-based
Cool.
outcome.
Mm. And what are some of the examples that you heard, like people using GenAI in the healthcare industries, and how are they kind of integrating AI into their regular workflows right now?
Yeah, I would look at AI is a tool that help us doing data normalization. I know I talk about data normalization sounds kind of technology, but data normalization means that how we use the data that you collect, clean it up in a way that you can use it for specific purposes without invading the privacy of patients. We may have to take out the patient's name, but we only collect the data that you need. For example, treating a headache is Tylenol. Maybe a cold, you may want to get something like maybe NyQuil, for example, like prescription like that. In some way, how can we use the data instead of using the human being characteristic to tie into that? I think these are called data cleansing, data normalization. And even think about another way to do is figure it out using AI to bridge the gap between non-structured as well as structural data. There's no single Microsoft SQL table that describe healthcare. It's so many tables, so unstructured. Medical images, data is everywhere. How can we use AI to bridge the gap, figure out a way how to use that, move forward with the set of data you have to drive, again, maybe drug discovery is another outcome that we want to do something with that. Maybe enhance population health. There's certain stack that we want to do that. Maybe even improving the clinical decision making. How can we use the data that we collect in there to drive that outcome? Again, it's still early stage right now, James. I think, I want to ask you too, what do you feel? What do you feel about this healthcare and using your data? Tell me what your perspective is, James.
Yeah, we work with like a couple of different customers that is in healthcare. And number one thing that we've been hearing from these customers, both from the provider side as well as the hospital system, is that they are very concerned about what data that GenAI can consume, because like what you said, the big P, right? Privacy is a big things for for these healthcare organizations. But at the same time, for GenAI to work, they actually need the data. It either that you use things like Microsoft Copilot, or you use other LM to do classification of unstructured data. All of that they need to see the data. So that's where we see a lot of organizations is very cautious in terms of adopting GenAI, but once they get over that hurdles, a lot of them see tremendous boost in terms of productivities for their employees, as well as like the improved outcome for their patients.
Absolutely. I find that too is every month I go to meetings and the meetings talk about what can we do with the data? What can AI help with that? Because the system is moving very fast. A lot of manual process that's happening in the back end. A
Yeah.
lot of human being touching the data and touching the data, great. But there's a manual check. What about automations? What about automatic QA processes? Again, the outcome of that we are seeing in many cases, we like to let the system do the co-pilot first, assist on a decision before we take in the autopilot mode that, things will go automatically. We're still worried. I'm still scared, even for myself. I like to, have a manual check, double check things before giving a decision that I need. And again, my outcome is I want to feel better every day. Hey, I'm a healthcare customer too. And I'm building system myself. I'm supporting system myself. And I'm a true believer of technology. That's why I'm in the tech industry. I don't join the org as a salesperson, but I'm a tech sales. I'm selling the business AI and the use of that, and I'm bringing you along too, James. Explain how the AI security will work in many cases, and joining your conversation with many times, and listen to other experts and truly understand what is the meaning. I'm curious, and I think you're curious too, and a lot of people are more curious than I, and I have to explain concept that I have. Well, okay, I think I know, but let me get you the expert. I'll get James on the call. Explain, please. Yeah,
Yeah, yeah, definitely. I think that's a good part of being in our business, which is the ability to help influence the adoption of Gen AI. So with that being said, like, what are some of the use cases that you are seeing people adopting Gen AI in healthcare?
So the GenAI side is what is available right now.
Yeah.
What is available right now, meaning that the Microsoft Copilot, if you company using M365 Copilot is just a matter of click, apply, and pay the bill. There you go. Copilot is ready to go. And even if people using Google Workspace, there's also Gemini in there. Click, apply. Again, submit the payment. There you go. You got GenAI already enabled in that. And even, I'm not sure that you have you have Zoom meetings that have the AI companion. How can you start using those easily accessible AI to at least get through maybe meeting notes? Let's get a start first. Meeting notes. I don't have to photo and write notes. I just go to AI companion and do a summarization of outstanding tasks that I have to get done. And maybe using Copilot within my Microsoft, I'm just going to do a search of, hey, can you help me even reply to a quick email that I am looking for summarizing the meeting notes? I think that will be my first use case. But I know my boundary though. If there's something with a PHI associated to that, I'll probably just, hey, as a human glance, just to take a look with that. But I still feel that we need to get the proper type of tooling, security tooling and DLP tooling, maybe even a guardrail. People talk about guardrails. Maybe even James, maybe your team can actually help me out on putting the guardrails in front of the business and say, by the way, this is a great use of that, but you're hitting the boundary. May not be a good idea to put it in there. Maybe you should just slow it down and rethink about strategy before you start putting Gen AI into the business use. One business use case at a time. And for me, I can sleep better. And I don't have to rely on my coffee too much because I'm always worried things will happen.
Yeah, I think that's good to know, right? I think having guardrails is important to manage the risks and the challenges. So from the company perspective, being aware of all these risks that are associated with GenAI, like why and what push forward the adoption of GenAI in companies like Episource?
I think with that said, just keep thinking about what efficiency brings. Efficiency is a process equation. Business process equation define the outcome. And again, the outcome is that efficiency is what is the factor that you can have percentage of utilization saved for human being to drive a better, faster outcome, maybe a better outcome, maybe a cost-effective solution. I think that's where you see a lot of time. It's a huge marketplace for healthcare adopting AI. My AI adoption journey is, again, I'm dealing with medical data day in, day out. And I have my guardrails of what I can do with the data, but also have my guardrail of understanding, hey, from the business side, what efficiency you would get, because at the end of the day, if the business AI tool that you have bringing in will have to incur more people to do QA, and that will be not a good AI use case because you're introducing a lot of, I'll consider the good old days people talk about hallucinations of AI, or maybe even has removed certain things that you really wanted, when you're summarizing a note. I think there's still a human factor in there we got to put in there. Efficiency is what I'm chasing down, but I need to start looking at the use cases and truly measuring it, how to do it.
Yeah, I think that is really good summary of the importance to balance the gains versus the losses when you use GenAI tools. So with that being said, you kind of touched base on the guardrails. You talk like the risks, so you have to put guardrails and what people could do and could not. Like, can you discuss a little bit more about the security challenges of using GenAI tools? I think you mentioned about Copilot is one that you use.
Absolutely. I'll look at security more of is a risk. Risk come in the form introduced by the business. Business decided to adopt certain technology. Business decided to do something with the data. There's a risk associated to that. The traditional AI risk to you, James, is AI security risk that we have is data bias, algorithm bias, data privacy, security, lack of transparency and explainability, and even trying to figure out an AI governance framework. Good luck. There's like 3-4 major governance framework that the industry is trying to go through the second stage is still going on. I think it's still defining that, and even have the board oversight. There's an AI board oversight you got to introduce in there. You must have that, because if you don't have that AI oversight, AI governance board oversight, then your guardrail is gone. The guardrail is defined by a human. The guardrail is defined by the board. Not only one person governing it, is a whole group of business folks, including technology folks, including business folks, including maybe even a customer. Join the board. Let's talk about what is meaningful for you, because I'm using your data to drive a better value-based outcome. And again, James, your team has been doing a phenomenal job on understanding the AI risk, in particularly onto a ChatGPT. Is it evil, or is it is it angel? Is Glean an angel or evil? Hey, we'll see. Yeah, you guys are helping me to do the guardrail.
Yeah, I think that's really good to hear from you. And with that being said, like it sounds like you have some sort of like an AI consoles that governs this AI initiative, and then you talk about having oversight boards in a way that have like customers, technology partners, and maybe ITs and businesses. Like, can you talk more about like what different models that you see healthcare organization are trying to safely adopt GenAI? Like, is AI consoles a popular approach, or like what are other ways that you see people are adopting right now?
Council will only work if there is a way that the council being agreed on with everyone in the organization. Depending on the size of the organization, you may have a top-down approach. The C-level force it all the way down, or actually the people doing the busy work. The data scientists, the engineering team, the business folks, how they can draw all the way up to the management. There's no single concept will function well for organization, but I think in overall grand scheme is about understanding the business challenges before you throw in technology challenges back in there. It's always let the business define what is the governance in there, because at the end of the day, data is part of business. Technology only supports business.
Yeah, I think that makes sense. And the other question I have is that we talk about the risk, we talk about different ways to guardrails against risk. So let's say if, like despite our best efforts to guardrails and like having all this kind of approach to contain the risk, it will happen, right? One day or another. The goal is just to definitely minimize it, but what are the consequences of that? Let's say if a risk is not contained, and what would happen? Like, what are the consequences?
I think the consequences that you find in there is already been seen in the industry. There's a lot of questions perfectly talk about, again, 2024 December, you talk about PBM, Farmer Benefit Manager in the healthcare system. They're folks that, creating the pricing structure for payments and insurance copay and stuff like that. I think there's probably a data science driven behind the scene. I will not call it AI, but there's data science behind the scene to do the work. Can the data science drive the decision whether, hey, what is the insurance copay supposed to make sense to you? Am I paying $15? Does it make sense for my age group, or should I pay for more? And even all the way down to cash payment coming from the insurer itself. And how does it make sense? Outcome is you feel great at the end of the day because you have healthcare. What is the balance between the two? I think the complexity behind the scene is, can the data science have enough data to drive the decision? But the decision does not work very well in many cases because there are biases already created. If you train a model, junk in, junk out. You hear about this word all the time. Same concept into healthcare. You got to have the data properly determined. This is the right set of data to train before you have this outcome. I think that's what executive or leaders and even engineers, we are all afraid of how to do it right. Tell us how. I think the industry will define the goal. And particularly, we're looking at one business problem at a time. You don't look at the overall big problem just to try to solve it first, because it's a very complex problem. Insurance and outcome, payments, copay. The ecosystem is too big to even figure it out who to touch what belongs to who. So yeah, James, I know it's. I wish you would give you a simple answer. A plus B equals C. If you divide it by 12, that becomes per month. No, it's not like that. It's very complex in this system. Yeah.
I can imagine. And from the compliant perspective, right? Let's say if you violate these guardrails, and I think you mentioned about PSI information earlier. Then I think with this algorithm that you talk about, what are the issues or what are the consequences of violating these compliance?
Well, first thing, a slap on the hand. No, there's no slap on the hand in this industry. A slap on the hand mean that is going to be a dollar amount fine from regulatory body. For example, the Attorney General, the AG. The AG always may say, hey, there's a class action going on. Hey, the AG may come back say, hey, you don't handle the data properly, then you get sued, and there's X million dollar of settling. That's typical, class action lawsuit. The second part of that, I think the SEC, FTC, the three letters agency that we don't want to talk about it. They're always there. They are trying to find ways to make sure that the general public understand the value of their enforcement policy, and going from maybe even at the end of the day, if you don't handle it properly, you may lose the company because you cannot do business anymore because you're violating the terms of agreement. Your company may not be able to do process insurance or maybe handling things because it's just legal hold. I call it a long-term legal hold, and that is the end goal that nobody wants. But again, I think with the industry regulations one part, and then the government side, I think the new existing legislation, they're trying really, really hard on understanding from the general public. Again, we are the general public. What does make sense to me? How to enforce the policy in the right way? Does it mean that if I don't train the model properly, does it charge you for like $16 per record, or is it going to be $5,000 per record? And if you don't have the right outcome for taking care of people's health, you're talking about people's health, life and death.
Yeah, so we're almost at the end of the podcast. So I wanted to ask you quickly, what would be your advice for other IT or security leaders in the healthcare industry that wanting to adopt GenAI?
Know your data. First thing first. Know the data. Know your enemy, and know your partner, and know about yourself too. Because at the end of the day, healthcare means yourself too. I know it sounds like a selfish discussion, but hey, know about yourself first. What do you mean? What does it mean? Because you are your own guardrail, your own firewall. What does it mean to you does not mean what it means for the business. You may want to have an idea and just talk to your business leader within your operations. Maybe talk to the ops team, talk to your revenue team, talk to the marketing team within your healthcare company. Maybe even talk to a doctor. Talk to your best chiropractor that you go see all the time. See what do they think. How do they do a better job to take care of you? Because the amount of data that you asking them to you're building using your technology and the data that you collect is very meaningful day in, day out. So I think this is my advice. Think about yourself, think about the people around you, and think about the system, and think about who you want to bring along. Maybe bring James along too. James is a smart person. He has a lot of crazy idea how to secure the AI. Yeah, seriously. Yep. I've never heard about that too, but he's got an idea. Talk to him. He's got a lot of expert idea of how to build it right. And even talk among your peers. Go join conferences and start talking to your leaders in the space and see what they think. And that's my advice.
Yep, that's really good. All right, that concludes our podcast. So very great to talk with you, Jonathan.
Hey, thank you so much, James.